Hamjambo tena. Distinguished guests, ladies and gentlemen, today is a great day for our country, Kenya. The launch of the HPV initiative that marks a major milestone in the fight against non-communicable diseases, especially cervical cancer. Indeed, as you are aware, cancer is one of the leading causes of deaths from non-communicable diseases, which include diabetes, hypertension, pulmonary diseases. However, it has been made known to all of us that if diagnosed early, 2/3 of cases can be managed and even more lives saved. This therefore points to the crucial role of early cancer screening, detection, and prevention. In light of this, the HPV vaccine that we launched today, which, as you have heard, is already in use in very many countries across the globe, forms a priority intervention in ensuring the prevention of cervical cancer amongst women. Access to the HPV vaccine by our girls will lead to a reduction in the number of new cervical cancer cases and secure the lives of our daughters and our sisters. This means that our young women, who are critical to the future of our nation, will be protected from early deaths. The vaccine that we launched today will be available to girls in all public health facilities, as well as private, faith-based, and non-governmental organization health facilities across the country. Indeed, the launch of the HPV initiative coincides with our ongoing efforts to improve and strengthen prevention and management of cancer in our country. Recognizing the needed investments and the role of multi-sectoral interventions in the control of non-communicable diseases, my administration has taken a number of measures across various sectors to intensify action against non-communicable disease. Firstly, we have enacted the Cancer Prevention and Control Act, number 15, the Tobacco Control Act, the Environment Act, and my administration has put in place a robust legislative framework that addresses the key risk factors of cancer in our country. Secondly, access to cancer screening services has been improved through the provision of basic and advanced screening services across all primary health facilities in our country. The screening services covered include cervical cancer screening and advanced breast cancer screening, including in all our county referral hospitals. Thirdly, investments have been made in strengthening cancer research, diagnosis and management through the establishment of radiotherapy and chemotherapy units in Nyeri, Meru, Embu, Mombasa, Nakuru, Garissa, Bomet, Kakamega, Kisumu, and Machakos. Further to this, I'm glad to note that the newly completed Kenyatta University Hospital will be operational by the end of this month, providing increased access to cancer management, through its state-of-the-art cancer services. Also, through our National Hospital Insurance Fund, Kenyans are now able to access the oncology package. The package targets cancer management by use of basic and complex chemotherapy, radiotherapy, and support to diagnostic and staging radiology services, which so far has benefited a large number of Kenyans. As a government, we recognize that effective delivery of the interventions that I have enumerated above will depend on the vitality of our health systems and in a strong and responsive primary health care approach. Therefore, jointly with our county governments, I believe we remain committed to ensuring universal health care coverage, currently at the tail end of the pilot phase, will be implemented at scale across the entire Republic. Ladies and gentlemen, boys and girls, as I conclude, it is important to note that making significant health gains from the measures we are taking will also require that each and every Kenyan takes responsibility for their health. Specifically, each and every one of us must ensure that we try to lead a healthy lifestyle and routinely and early enough seek appropriate screening services. And therefore, my fellow Kenyans, we must all participate regularly in the physical activities that we can and proceed to control the use of harmful substances to our bodies. Let us all take collective responsibility in leading healthy lifestyles that will galvanize Kenya into a healthy and prosperous nation. Asanteni sana. Ningependa tu kuongezea pahali gavana na waziri wamesema kwa machache tu. Ya kwanza, kuwashukuru wale wote ambao wamehusika kwa mradi huu wa chanjo ya wasichana wetu, kwa vile wamefanya kazi pamoja. Kutoka wale ambao wametusaidia wenzetu, development partners, county governments, faith-based organizations, non-governmental organizations, na Wakenya wote ambao tumeshiriki pamoja. Na nataka kuungana na wale ambao wamesema hapo awali ya kwamba maisha na hali ya afya ya Wakenya sio kitu ya kuchukuliwa rahisi. Sana sana tunaona twagombana katika platforms za kisiasa, za kanisa na kwingine juu ya wema na uzuri wa kitu. Na tunasahau ile science ambayo atakikana kutuongoza. Nataka niwashukuru wakati huu kwa sababu wote wamekaa pamoja. na wote wamesema ya kwamba hawataki waingizwe kwa siasa. Haja yetu ni maisha ya wasichana wetu. Haja yetu ni maisha yao. Tukiwa sisi wote tumeona vile huu ugonjwa umevunja familia na zingine zimezoroteka kwa umaskini kwa sababu ya kujaribu kulinda mama, baba, mtoto ambao alikuwa na huu ugonjwa. Sasa jameni, tukikosa kufanya lolote tuwezavyo kuhakikisha ya kwamba even if we cannot eradicate, but at least minimize to a great extent this disease and protect not just our children but our families. Kwa sababu mimi najua hakuna mmoja hapa ambaye aweza kusimamia aone mtoto, mama ama mzee akizidiwa na huu ugonjwa na tukose kufanya lolote. Utauza shamba, utauza nyumba, utauza nguo ya mwili kuhakikisha umesaidia ambaye ameathirika. So please, let us not fight science. Let us work together. Let us answer questions from an intellectual point of view. Let us talk and discuss and let us agree, because I believe we all mean the same. We all want the same. We all want a bright and prosperous future, not just for ourselves, but more importantly for our children. Kwa hivyo tukisonga mbele, mimi ombi langu vile nilisema juzi, wa Kenya tuko na jukumu. Kansa haikujui kwa dini. Kansa haikujui kwa rangi. Kansa haikujui kwa kabila. Cancer affects and attacks all of us. We must work together to defeat it and to reduce its impact on Kenyan society. Wenzetu, I want to once again thank, through His Grace the Archbishop of Mombasa, Archbishop Kebuba, and all of you who have been involved. Let us walk this path together, and I'm sure that if we succeed, it will put a smile on every single child in this country. Mungu awabariki, Mungu awalinde.